Hello, we are continuing to highlight innovations that have occurred at the College of Veterinary Medicine. Joining me today is Dr. Stephen Suter. Hey, Dr. Suter.
Good afternoon. How you doing?
I'm doing good. So tell us a little bit about yourself.
Well, I'm a professor of medical oncology in the Terry Center at the hospital here at NC State. I did a veterinary degree at University of Pennsylvania, then stayed on and did a PhD there in molecular biology and molecular genetics, working on a model for gene therapy of severe combined immunodeficiency in dogs. And that's actually where I learned about all the data out there on bone marrow transplantation in dogs. Then I did a residency out at UC Davis for a couple of years, and then took a faculty position here in 2005. So I'm currently a clinician scientist in the university here.
Neat. And tell us a little bit about the innovation you're highlighting.
Well, today I wanted to talk about the canine bone marrow transplant unit. We're the only university in the world actually that has a canine bone marrow transplant unit. And so I wanted to talk about that.
Yeah, so what's the history of it?
Well, as I said, I learned a lot about bone marrow transplantation in dogs during my PhD at Penn. And when I became an oncologist, it became pretty clear that there was a need for something like this in dogs, since chemotherapy rarely, if ever, cures dogs of lymphoma. It's a very treatable disease, but it's essentially incurable. As it turns out, there's a ton of literature in the human field about the ability of bone marrow transplantation to being able to cure dogs. And so that was a revelation to me when I learned that. And so I basically took the data that was generated mainly at the Fred Hutch Cancer Research Center in a research setting and brought it over to the clinical setting. So the hard part was trying to get it set up in the hospital where we could treat client-owned dogs who had lymphoma. And so that's the unit. It started in 2008, and we've been running with a little bit of a break for a couple of years since then. We've treated a total of about 97 dogs so far with bone marrow transplantation.
Wow, and who else is in the unit with you?
The unit is myself, and I also have, thanks to the support of the hospital, two bone marrow transplant fellows. So I've had fellows coming in since about 2010 to help run the program, because it is a lot of work. And so the unit supports two-year fellows that come in for 2 years. They're overlapping, so they can teach each other, and I don't have to do all the teaching. And so, yeah, it supports them. It's basically me and two fellows. We do all the bone marrow transplants, and we also do all the apheresis techniques that we can use to treat other diseases also. So the fellowship is really an apheresis fellowship, which is using these machines to treat, for example, immune-mediated diseases or toxicities, and then bone marrow transplantation kind of falls under that also. The whole unit has really been put under the umbrella by the hospital of a extracorporeal unit, which includes dialysis and then apheresis and bone marrow transplantation. And Dr. Shelley Baden is the head of that whole extracorporeal unit.
That's fascinating. You said NC State's the only university to have a dedicated unit for this. Do you think this is something other universities would pick up?
Well, I always hope so. I mean, the whole point of this was not only to just treat dogs here, which I can only treat about 24 dogs a day, it would be to educate my fellow oncologists and veterinarians that this is a viable alternative. So I had always hoped that other universities or private practices actually would do this, because we need to treat hundreds to thousands of dogs to really make a dent in the lymphoma epidemic that's going on. That hasn't quite happened yet. There are some private practices that do bone marrow transplantation, but no other universities have picked it up yet. It requires a fair amount of work and a fair amount of expertise to harvest the stem cells and treat these dogs. So it's really not an area that, as veterinarians, we're trained to do. So a lot of my job has been trying to educate a medical oncologist into the feasibility of it, and also prove that you can cure dogs with lymphoma, which is really the whole point of all this. And we've proven that. But we still haven't got transplant units into other veterinary academic institutions thus far, unfortunately.
Yeah, not every university has a Steve Suter.
That's right. That's right. Unique, one of a kind. Ask any of my colleagues.
Well, thank you for sharing all that information. It's very fascinating, and thank you for all your hard work.
Oh, my pleasure. Thanks for having me. Appreciate it.
Okay.